Hi guys, welcome back to the channel and my series all about the ins and outs of travel nursing. If you're new here, my name is Olivia, and for the last 3 years I've been living out of this RV with my husband and 2 rescue dogs, and I've traveled all over the country as a travel nurse. This video is going to be all about how you decide what travel agency to go with, because there are tons of them out there. And to kick things off, I'm going to say something that sounds a little bit backward, but just go with it. I recommend getting a profile set up with multiple different agencies, at least 2 to begin with, and that's because no 2 agencies are the same. You'll be able to compare different rates, different benefits, different available contracts, and as mentioned in a previous video, sometimes hospitals have relationships with specific agencies, and therefore they will only fill their need through travelers that are working for that agency. Do not give out any of your contact information to a travel nurse agency unless you are completely serious about getting a profile set up with them. And that is because a recruiter will be calling, texting, and emailing you pretty regularly about getting you on an assignment. So the first thing you're going to want to look at when you're getting into figuring out if you want to work with a specific travel agency is seeing what kind of benefits they offer. Make sure they offer all the benefits that you need: medical, vision, dental, or a combination of the 3. Another thing to pay attention to is when exactly do those benefits start. I think I worked with a total of 4 different agencies throughout my 3 years, but I did have profiles set up with at least 6, but the 4 I did work with had different benefits, so just make sure you pay attention to that. When I first got started, I worked with an agency that I would no longer recommend. I will be sharing some details about that throughout this video and future videos, but the first thing that should have had a light bulb go off in my head was that their benefits did not start day 1. They didn't even start 30 days into the contract. They started after a full contract, and they were doing that to try and employ travelers to stay with that specific agency and not go elsewhere. There are agencies out there that have day 1 medical, vision, and dental plans. So if that's important to you, make sure you look on their website and see that that's happening. Okay, so we want to look for when benefits start. We also want to look for when they end. One of the greatest things about travel nursing, in my opinion, is its flexibility. Contracts are normally 13 weeks in length, and you don't have to extend or jump into another one if you don't want to. For people that work in healthcare, I think this is a godsend because we not only deserve, but we need some time to just chill out after a stretch of work like that. But in order to chill out stress-free, I like to work with agencies that allow my benefits to continue for a certain amount of time after I'm off the job. And there are agencies out there that do that. The agency that I worked with the most offered 30 days in between contracts of full benefit coverage. So knowing when benefits end is definitely another thing to look for when you're going over the travel nurse agency website. Another obvious thing that I'm going to just mention, if you happen to be traveling with your partner and they get insurance through their employment, if you are able to get on their insurance, then you can take more than 30 days off. That's been my experience, and it is a 10. The last point I want to make when you're deciding what travel agency to go with is just the general topic of recruiters. And I'm only going to talk about this briefly because I'm going to do a way more in-depth video about recruiters, but just know that the recruiter is not necessarily a reflection of the agency. If you don't necessarily mesh with that recruiter, you can get a different one and still work for that agency. But if you're just starting out, things can be more stressful if you don't mesh well with your recruiter. Your recruiter is your point of contact throughout that travel assignment. They're going to be the most interactive with you at the beginning of your assignment and when you apply, just to make sure that all of the things that they need for your profile is set up, but also everything that the hospital or the facility that you're trying to get contracted at has everything that they need from you as well. Once you start your travel assignment, a really good recruiter, in my opinion, would continue to check in and make sure that things are going well, but they can also just kind of fade into the background and just be there for you and kind of feed off of if you need them. So for now, I will just kind of go through a quick list of pros and cons of a travel nurse recruiter. for. A quick list of pros, in my opinion, would be they are responsive quickly when you reach out with questions or concerns. They are knowledgeable about the agency that they work for. They're not pushy or manipulative in trying to get you to sign on with their agency. They are understanding of your desires for a specific contract, whether that's the place you want to go, the shift that you want, things like that. And so the red flags are obviously the counterparts to all of those. They are not quick to respond if you need a question or concern answered. They don't seem knowledgeable about what that agency can provide for you, or they can't get information about the facility that you're attempting to work at. They treat you like a number. They don't remember details about you, and they're pushing a lot of contracts your way that don't align with what you really want. But again, we're going to dive in a lot deeper when it comes to travel nurse recruiters, so just have your eye out for a future video. So that is a brief overview of what I think is important when you're trying to determine if you should work with a travel agency or not. If you have any questions or concerns, please leave them in the comments below, and know that the agency that I felt that I worked the best with is tagged in the show notes. Be sure to subscribe so you don't miss a future video of this series as we talk more about travel nursing. Goodbye!